Today we've got the second annual CPSSQ Symposium, and really that's an opportunity for two things. First of all, for some of our researchers to showcase their work to an audience of researchers, policymakers, the public, healthcare professionals, but secondly, and I think perhaps more importantly, to try and encourage some debate, some discussion, and hopefully some future collaborations around patient safety. Professor Lord Arora started the afternoon with an introduction explaining about the Centre for Patient Safety, what we do, and what we're trying to achieve in terms of patient safety research at Imperial.
We felt, despite this wonderful meeting that we have once a year, there's a bit of a dissociation between what we're doing in terms of research and what we're doing in terms of translating the research and the evidence into clinical practice. So working with the Trust, we came up with a wonderful scheme which in many ways inviting the very large number of staff within the Imperial College and NHS Trust to submit some of their ideas in terms of enhancing patient safety. And we had an amazing number of applications.
The afternoon then continued with 3 research showcase presentations. We started with Professor Paul Aylin, who gave us the research background behind a lot of his recent media appearances, exploring the questions about whether there is a higher patient safety risk at weekends.
We had over 4 million admissions with over 200,000 in-hospital deaths. And if you just looked at the crude mortality, we did find an increase risk for in-hospital death for weekend admissions. We looked at 50 diagnosis groups, and in 17 of those 50 diagnosis groups, we found a significantly higher odds of deaths, including stroke and acute myocardial infarction. We also pooled all the data and looked at the overall odds of death, and overall, if you were admitted as an emergency case at the weekend, your odds of death was around about 10% higher than if you were admitted during the week.
The second presentation was Matt Harrison, who's one of the senior designers at the Helix Centre, and he talked to us about this concept of frugal innovation, which is about trying to get designs that have a maximum benefit with minimum costs and minimum barriers to implementation.
So Helix, we are a unique design studio embedded in a hospital. But we're here to design for the wider healthcare system. We're using our position within a hospital as a space for research, as a way of connecting with clinicians and patients throughout the design process. We're focusing on frugal innovation, so that's high impact with minimum barriers to implementation. We choose projects that make significant difference, and our outputs are aimed to be more commercial and academic. Our success is going to be measured on whether we generate IP licenses, spin out companies, and efficiency savings for the NHS.
The third of those presentations was from Dr. Maria Ahmed-Drake, and she's done a lot of work around how we can provide training in patient safety for junior doctors.
So the aim of this work was essentially to develop, implement and evaluate a patient safety training programme in order to promote structured analysis and reflection from patient safety incidents, to improve trainee safety competencies in terms of knowledge, skills, attitudes and behaviours, and as a broader aim to address the barriers to sustainable implementation of training programmes in safety.
We then had an interview. Dr. Josephine Ocloo brings experiences as a harmed patient who lost her daughter due to a whole series of very tragic events.
Well, it's been heartbreaking.
Yes.
It's been absolutely heartbreaking because, first of all, there's been the loss of my daughter. And you cannot come to terms with that sort of loss, particularly when a child, a much-loved child, dies suddenly and unexpectedly. You know, there are no goodbyes. And then you find yourself labelled and pathologised. If they'd been open and honest, and I have shared platforms, I shared one amazing platform with a doctor who talked about the impact upon the family, and it completely changed things, and in fact they ended up being quite close. And I just believe if that had happened to me, my life would have been so different.
Josephine was very brave and very strong, I think, to be able to come and talk about these things to this kind of setting. And I think excellent that she's taking forwards her passion in this area, and she is going to be going forwards and doing some work with engaging members of the public in patient safety across the network moving forwards.
Josephine has just joined our team. She's leading on the Patient Safety Champion Network. And the goal of that is to ensure that all Northwest London GPs, hospitals, CCJs adhere to strict patient safety rules.
We had this idea of having a debate about technology. So we had a debate where the motion was, this House believes that technology is the way forwards for patient safety.
So there's a number of areas where technology is transforming or has the potential to transform outcomes. And I'm just going to touch on a few of them. And many of you will have kind of ideas about some of these. Decision support. Now, we would have no errors in NHS if we all followed the protocols and guidelines that are set for us. It is incredibly difficult and I think implausible to presume that every clinician can keep up to date with the latest guidelines.
Introducing new technologies will always compromise patient safety, simply because patient safety is built upon good human interaction between clinicians and patients and clinicians themselves. And it's that simple. I mean, if you think about it, one of the, if not the early driver of the patient safety movement was not the recognition of technological failure in healthcare. It was a recognition of the simple fact that clinicians and patients were not really communicating well enough.
Thank you very much to both of our speakers for a very lively and topical debate. I'm now going to ask everybody to re-vote on the motion, and let's see who swung which direction. So this House believes that technology is the way forward for patient safety. All those who are now for the motion, hands up. Okay, definitely more. And all those who are against? I think it's a draw. I think we're going to have to call it a draw. Thank you very much, everybody.
The afternoon ended with a keynote speech from Professor Sir Michael Richards, who's the Chief Inspector of Hospitals for the Care Quality Commission. And he talked to us about the new approach to inspecting hospitals, some early findings from that, and where the CQC is planning on taking us with their new approach.
What is the CQC? Well, the CQC is the regulator of health and social care. So it crosses the patch. It's also very important to say we inspect and regulate both health service and the independent sector. So we make sure that health and social care services provide people with safe, effective, compassionate, high quality care. We encourage them to improve. We are not an improvement agency per se. That's for other people to do. But we very much hope that we are an agent for improvement. In other words, I and my colleagues wouldn't get out of bed in the morning to do this if we didn't hope and believe that we could really drive improvement. How do we do it? We do it through monitoring, inspecting, regulating. First of all, to make sure that people achieve fundamental standards. But we go far beyond that now. And this is one of the things that's new about the programme. We're also looking for what is good or outstanding. And that's where the ratings come in, and I'll talk more about those. So we are trying to look across the whole spectrum.
If you were to ask me what success looks like from this afternoon, I don't think it's really about sharing the findings as such. I think success is about encouraging collaboration, debate and discussion, and hopefully some new collaborations, some new ideas that we'll be able to take forwards to improve patient safety.